Our Lora Windsor reports now on an important issue women need to hear about.
Roger, an estimated 51 million women, 17 million of them in the U.S. alone, cope with urinary incontinence. Dr. Matthew Clark, a urogynecologist at Hoag Memorial Hospital Presbyterian in Newport Beach, explains this condition and the treatment options currently available to women.
Urinary incontinence is defined as the involuntary loss of urine that a person experiences that is either a social or a hygiene problem for them. Two main issues we see is number one, stress incontinence, which is a loss of urine that's associated with a cough or a sneeze. The other major cause is overactive bladder, which is an involuntary spasm or a premature bladder contraction, which is hard to control.
According to Dr. Clark, the treatment is paired with the best diagnosis.
We start by talking very carefully with our patients, determining what their circumstances may be. Oftentimes we might need more advanced testing in a way to figure out what is their specific problem, and then treatment is then recommended and undergone. Treatment for stress urinary incontinence begins with the pelvic floor rehabilitation. Getting the pelvic floor muscles engaged and strong and active will often take about 50% of our patients and improve them.
The second most common treatment for stress incontinence is a surgical correction.
The latest advances for treatment for stress urinary incontinence is the evolution of sling surgery. In the last 10 years we've seen it go from a longer procedure, approximately 1 hour, sometimes a one-night stay in the hospital, now to almost all patients are treated outpatient through a single incision. They're able to return to normal activity, work, taking care of their daily lives within days. Further workup with physical examination. Advanced testing is often necessary to pinpoint the diagnosis, and from there we're able to solidify a treatment plan and often proceed forward with a high chance for success.
Dr. Clark tells us about the latest research.
Currently there's been some great twin studies just completed, and we always thought it was very familial, but it's so hard to separate familial versus something that just happens to people that live similar lifestyles. So that the genetics are still kind of questioned right now with the good twin studies, but certainly people that live similar lifestyles will have similar issues. We think incontinence is a breakdown of the connective tissue and the nerve and muscle function of the pelvic floor. That breakdown occurs with childbirth. It occurs with a vigorous activity and work lifestyle, and progresses as people age.
If you are one of the many women who suffer from urinary incontinence, ask your physician about a treatment plan that works